Hello, my name is Kristy Nelson, and I'm an oncology nurse at the Merle Cancer Care Center at Island Hospital, located in Anacortes, Washington. Today I will be talking to you about chemotherapy and hair loss. For additional information on hair loss that goes beyond this podcast, please refer to the American Cancer Society's hair loss resources. Whether you're male or female, if you have cancer and are about to undergo chemotherapy, the chance of hair loss is very real. Many patients report hair loss as one of the most feared side effects of cancer treatment. Drugs involved in chemotherapy are extremely powerful medications that attack rapidly growing cancer cells. Unfortunately, these drugs also attack other rapidly growing cells in your body, including those in your hair roots. So, as chemotherapy does its work against cancer cells, it also destroys hair cells. The hair loss is not limited to just the hair on your head. Chemotherapy may cause hair loss all over your body, including your eyelashes, eyebrows, arms, legs, pubic area, and armpits. Not all chemotherapy drugs cause hair loss. Varying doses can cause anything from a mere thinning to baldness. Talk with your doctor or nurse about the medications you will be taking so they can tell you what to expect. Hair loss typically doesn't happen right away. It usually begins falling out 1 to 3 weeks after you start treatment. It can fall out in clumps, or it may happen gradually. Accumulations of loose hair on your pillow, in your hairbrush, or hair in your bathroom drains are things you may notice. The hair loss will continue throughout the course of your treatment and can continue for a few weeks afterward. You may notice that your scalp becomes very sensitive to washing, combing, or brushing. There are several ways that patients can prepare for this transition. Some people have their hair cut prior to chemotherapy. Others choose to shave their heads completely. If you are not too concerned with hair loss, scarves and hats may work just fine and protect the head as well. Well-made synthetic and human hair wigs are available also. Wigs come in all textures, colors, and styles. If you do think you want a wig, it is wise to purchase it before treatment or early on in treatment, and be sure to ask if the wig can be adjusted, because you may need a smaller wig as hair loss progresses. There are several resources available for cancer patients that are anticipating hair loss. To learn more about hair loss resources, ask to speak with your patient navigator. Your navigator will help you understand what's available locally, including a free wig and hat bank on site at the Merle Cancer Care Center, and free classes that discuss hair loss and skincare during treatment. Additional resources outside of the Merle Cancer Care Center are also available in Anacortes, Oak Harbor, Mount Vernon, Cedar-Woolley, and Bellingham. Your patient navigator can help you with this as well. The good news is that most hair loss from chemotherapy is temporary, unless you've had very high doses of particular chemotherapy drugs. It may take several weeks after treatment is complete for your hair to recover and to start growing again, but it can take several months to grow back completely. Usually, the hair most likely to fall out first is the first to grow back. The hair on the top of your head grows faster than your eyebrows or your eyelashes. Be aware that when your hair does start to grow back, it is likely that it will be different from the hair you had before. The new hair may have a different color or texture, or be thicker, straighter, or curlier. Sometimes these changes are only temporary, and sometimes they're permanent. Management of hair loss is focused on the comfort of the individual. Keep in mind that if you live in a cool climate, you want to keep your head warm. In a warm climate, you want to protect your head from the sun. Short hair, wigs, hats, or simply shaving it off are all options to consider. Remember, the best option is the one that is most comfortable for you.
I must be down to at least under half of my head of hair, I think. Something like that. Here we are. What do you think?
Thank you for listening to the Merle Cancer Care Center's oncology podcast program on chemotherapy and hair loss. For more information or to schedule an appointment, call the Merle Cancer Care Center at 360-299-4200.